Good morning, welcome back. Well, September is Childhood Cancer Awareness Month. Every day, 43 children are diagnosed with cancer. And joining us this morning from Gundersen Health System is Dr. Jen Orozco. Dr. Orozco, thanks for waking up with us this morning.
Absolutely. Thanks for having me.
When we talk about cancer, it's kind of a broad term that encompasses a number of more specific diseases. Are there any that tend to affect children more so?
Absolutely, there definitely are. Unfortunately, we see a wide variety of types of cancer in children and young adults and adolescents. The most common is something called acute lymphoblastic leukemia, or ALL. That's by far the most common one we see. A type of leukemia, not typically seen in adults, but we also do have adult patients that we sometimes take care of as well. And you know, the most common after that would be brain tumors, different types of brain tumors that children can have.
The technology has just advanced so much in seemingly such a short amount of time. What's the outlook for somebody who's diagnosed with cancer, a child who's now diagnosed with cancer?
Right. Luckily, it's improved dramatically. 40 years ago, the prognosis was dismal. It was less than 10% and really horrible. Over the last 30, 40 years, it's improved dramatically to currently the most common type of cancer, ALL. The cure rate is 85% to 90%. Now, that's not perfect, but it's a lot better than it was 40 years ago. So we're lucky for that. Other cancers are right there with it, with some not having quite as good prognosis as others, but most cancers are right there with it for pediatric cancers.
Now, we don't have a lot of time left, but real quick, are there any things that parents of children can do or kids themselves can do to kind of prevent or lower their risk for certain types of cancer?
Yeah, that's a great question. You know, it's a little bit different than adult cancer, which I think most people are a little bit more familiar with, in that there's not a known cause for most pediatric cancers. Acute lymphoblastic leukemia, not really a known cause or things that you can do to prevent it. You know, it's always good to have a healthy lifestyle, so eating well, exercising, those basic things, but for those main, most common types of cancer, there's not any preventative things. Things like skin cancer that children can get and is on the rise, you know, using sunscreen, things like that is always a good idea to protect against the sun.
Certainly, just do whatever you can. All right, Dr. Orozco, thanks for joining us this morning.
Yes, thank you.
And we'll head to break with